after a short while, I discovered your work. Well, I mean, and with Cynthia.
Yep.
And that was a very happy day for me because, you didn't call it maladaptive daydreaming, but it was obvious that we're talking about the same thing. So that's when I reached out to you, not knowing that you were Susan.
Yes, exactly. Yeah,
Suggesting we collaborate. And from this, by the way, the first empirical studies on maladaptive daydreaming were born. So we were fortunate enough to take part in this important endeavor. And the maladaptive daydreaming scale was born out of our collaboration.
Yes. And that is so, so your average viewer might not understand, but that is so important because it's hard to get research published if you don't have the tool. So now that we have a scientifically validated tool, like you've got, I think, a whole group of colleagues that are doing a lot of research, whereas we really had a fight to get those first articles published because it wasn't a validated tool. What has anything changed from, I mean, it must have, because there's so much more research. That very first article with this 6, I think we both saw that there was a connection between trauma and maladaptive daydreaming. Our thinking on that has changed a little bit since then.
Right.
Like, is trauma required for maladaptive daydreaming?
Right. Well, and it was I think in the paper that you led that we found out that only about a quarter, but certainly not more than a third of people with maladaptive daydreaming reported childhood trauma. So that is still very high, and the correlation exists. And we were able to replicate studies showing a correlation, but clearly, trauma is not the necessary condition for maladaptive daydreaming. And then, I had to rethink what is it? What is the essence of this disorder? Because I was convinced it's a dissociative disorder, but we were taught that dissociative absorption should not actually be considered part of the psychopathology, because people get absorbed in movies, people get absorbed in their thoughts even while they drive, and their consciousness splits and they get safely to their destination without remembering how they got there. So absorption has been considered a normal part of dissociation, and there was talk about really removing it from our domain. So what is it? I do believe that we're talking here about some form of dissociation of consciousness, having a double consciousness, because people actually don't go away completely in their minds. There's some awareness of what's going on.
Yeah.
But so it's about absorption. It's about a unique capacity for powerful absorption, immersive absorption, which creates a very strong sense of presence. And apparently, so it's about dissociative absorption, but the intensity of this experience is reported, I don't have this trait, is reported to be very rewarding.
Yeah.
Because you're a master of your own universe.
Exactly. You're creating your own movies and books and TV shows. It's like, it's actually kind of fun. It just goes overboard. Right.
So some people like to do it more and more because it's so fun, but it potentially can create this addiction, habituation in every person. But of course, those whose life experience is not pleasant would benefit more from it. Those who have bad memories or are socially anxious or have depression would, of course, can use it as a means to regulate their pain, their distress, and go elsewhere, which is wonderful. Until it becomes excessive, of course.
Until it becomes excessive. Exactly. I think you and I are exactly on the same page as this, is that some people are just born with this ability. And after a lifetime of looking, I've got 2 family members, my niece, who's also my roommate. She said she spends half of her day daydreaming. But for her, she's an artist and a creative person, like she thinks it enhances her life. So I definitely believe that some people are just genetically born with this ability to create this wonderful world. And for
Right.
some people, like it's a good thing, right? Like I kind of compared to alcohol, like, for most of us, a margarita once in a while is a great thing. But for me, or like, so one family member was like, does it every night from 9 to 10 when other people are watching TV, will pace back and forth, pretend he's talking to famous scientists and politicians. But then at 10, he stops. Like I couldn't do that. I would, if I did that, it would have been all night. I wouldn't have slept. Right. So like, I think it's this ability to keep it to limited times. Like I remember in high school, I mean, I would not sleep. I would not eat. It would just be completely absorption. So,
Right, right.
um,
And the challenge, therefore, would be to teach people who do it excessively to do it in moderation and to be in control over it, not to stop it.
but
Not,
so
not necessarily to stop it, because like you can compare it, for example, to an eating disorder. You don't want people to stop eating. They need to eat. People, daydreaming has a lot of advantages, and it's just a normal mental activity. You can stop it, but you don't want to lose yourself to it and be
yeah.
a slave to it. You want to be the patron, the master of it.
Yeah. And what I did, I don't know if as a doctor, you've even approve of this, but what I did when I was on my medication, the Luvox helped control the daydreaming. I would play with my dose. So like, if I knew I was going to be on a 4-hour bus ride, I wouldn't take it the day before. But if I knew I really had to concentrate and get a project done, I would up the dose. And like, to me, that was amazing because I had this complete control. Like I was able to do it when I wanted to, but
Yeah.
it wasn't all of the time. And one of the ways I noticed I was better for the first time is, so I live in New York City, I take the subway to work, and I would always try to like avoid having people go with me because I wanted to daydream. And
Mhm.
one day after I was on the Luvox, the fluvoxamine that I was taking for OCD, I remember very vividly one day a colleague at work was like late. She's like, you go ahead. And I was like, no, I'm going to wait for you. Like, so I waited for her to finish her work to walk to the subway with me. So that was the first time in my life that I was like, wait, I prefer a real person to an imaginary person. So there is a way to get better, which leads
Yeah.
me to, I know there's no scientifically proven treatment, but what has shown promise in the treatment area?
Well, yeah, I'm glad you asked me, because some of the listeners may conclude that this medication is the ultimate treatment, and we don't know enough about. What we know is we did conduct a large survey of people usage of medications and recreational drugs, and we don't have any evidence that there is one particular medication that is the panacea that can
Yep,
help everyone.
agree.
There are probably different routes leading to maladaptive daydreaming. OCD may be one risk group or one pathway that, when combined with this trait, can create this compulsivity about it, and therefore a medication that is proven to be helpful for OCD could be significant in helping people with this condition, but it doesn't help everyone. What we concluded from that survey is that it's a behavioral addiction. A behavior. I mean, earlier I described it as, I defined it as a disordered form of dissociative absorption, but what is disordered is that it becomes a behavioral addiction. So from that, we thought we need to look at what helps people with behavioral addictions like gambling or sexual addictions and so on. I published a single case study which was very successful based on these ideas, which I could very briefly describe. And now we are writing up a randomized controlled trial that we did with 8 sessions over the internet self-directed, like listening to videos, home practice, and so on, which ended up promising. So what are the components of the treatment? This is a treatment about getting better control over the behavior, not the underlying issues. So it's about, first of all, upping the motivation, because if we're talking about an addiction, I mean, that is so rewarding. So you need to be highly motivated to understand the costs of continuing with this and the benefits of controlling it. So that's one element. We call it motivational interviewing. The second element was self-monitoring, because people do it thoughtlessly. I mean, they don't pay attention, they just do it.
Yes.
But when they start monitoring how much time and what are the circumstances, that in itself, just the monitoring, which is important for us as scientists to set the baseline and to see the changes. But just the self-monitoring, some people reported help them become aware of what, when, and how much they do it, and start reducing it. So it's the accountability. And the third element was mindfulness training. Apparently, when you are daydreaming intensively, you are not being present in the external world. You're not mindful to the external world. You are absorbed internally. So teaching people how to live mindfully, how to, type with paying attention to every finger, how to wash dishes and pay attention to the water, the temperature and the sound, the clicking sound of the cutlery, how to eat mindfully and so on. So that was a very meaningful intervention, because we also compared the mindfulness alone versus mindfulness with the other components, and mindfulness alone would do the job. So to make a long story short, it helped significantly reduce after 8 sessions, and then we had a 6-month follow-up. People retained their gains.
Wow.
Some people didn't, because we tested them. Some people lost their the diagnostic criteria. They did not meet the diagnostic criteria.
Wow, that's amazing.
Just after 8 sessions. So this is quite amazing. Not everybody responded so favorably, but this has a significant effect. However, what I must add is that addiction is said to be like a self-medication often for something. So you cannot take the self-medication without treating the underlying issue.
Exactly.
That requires traditional psychotherapy, identifying first what the issues are and then treating them.
So but both of us hear from people around the world, because it's not recognized other than you and your colleagues. There's no one who really specializes in it. So what if you're in, I don't know, the US, wherever, India, Great Britain, and you want help, how do you get this treatment, right? Because there's no one that specializes in it other than you and your team.
Well, not there yet, but what I would suggest to listeners, to viewers of this video, is to perhaps seek out specialists in addictions, in behavioral addictions, because they would know that it's important to teach you to control the behavior, but also to look at what's motivating you to lose yourself in this compulsivity. So that will be a safe bet. I mean, if you find a good therapist who knows about addictions and addictive behaviors, they would perhaps not understand about maladaptive daydreaming, but then I would suggest simply to any viewer who considers doing it, just referring the therapist to our research website. And when you Google maladaptive daydreaming research, on the first page, if not the first result, will be our research website. And there we have a page of publications with all the literature accessible.
Yeah, which is the so grateful for, because that's what I tell everybody who reaches out to me when they're trying to tell someone, if you go to a mental health professional and they tell you there's no such thing, show them the research, right? There's a whole line of research. Just because it's not officially in the DSM does not mean that it's not real. And any good therapist should be willing to read those articles, or at least take a look at it. And if they're not, find someone else. But I think that's exactly the answer. Find someone who knows something about like addictive behaviors, and then teach them about maladaptive daydreaming.